conditions. I found myself working in drug rehabs, which is bizarre because, most of the patients that I worked with were dual diagnosis. They have depression, anxiety, PTSD, and drug and alcohol addictions. Drug and alcohol addictions were usually secondary. They were just using, drug and alcohol as self-medication. So, working in these settings, I realized this system is further broken. We put people on Valium for a period of time and slowly wean them off, which is, kind of a bizarre way to handle drug and alcohol addictions. Just leave someone in a room, sort of in isolation for a long period of time, medicate their symptoms, and kind of inevitably discharge them. And of course, the relapse rate is really high. But became more and more passionate about, the use of ketamine over the years. And, I inevitably end up researching it again. And at this point, there's clinics doing this. There's handfuls of them, And so, I continue to just keep my eye on this whole thing. I thought maybe I'll go work at one of those places someday, And, at some point in time, I actually did. I went and looked into working at one of these clinics and realized immediately that no place that I found actually does it correctly. Because you can give ketamine to people and they will have a neurochemical response. Most patients, if you give them 6 ketamine infusions over a period of 2 to 3 weeks, you will see a significant reduction in depression symptoms. By the numbers, 6 infusions over a 3 weeks period of time, at 0.5 milligram per kilogram will have, a 60 to 80% reduction in symptoms of depression. It's, pretty consistent throughout the literature. But when I went into these places, I just saw people getting infusions, and I was thinking, this is an extremely missed opportunity to have therapy going on intra-session and afterwards, and integration sessions afterwards. And then furthermore, a huge problem in medicine as a whole is just a complete, no focus on lifestyle modifications whatsoever. You have patients, they go to their doctor says, hey, you have high cholesterol, the doctor puts them on a cholesterol medication, and then they're kind of like, cool, problem fixed. That problem's not fixed. That should be used as just a transitionary period of time. Okay, we're going to put you on this pill for a period of time. It's going to keep your cholesterol down transiently. You've got to start exercising, getting your diet in order, because we're only going to keep you on this medication for 6 months. After that, we don't prescribe anymore. That's the way it should be done. In the same way with any form of antidepressant, there are plenty of patients that, probably do need some form of pharmaceutical management. They have extremely severe symptoms, actively suicidal. Those patients probably do need to have a pharmaceutical medication to manage their symptoms. Otherwise, their mortality increases. But that's not the solution. You don't just supplement neurotransmitters to solve a problem. You try to figure out why they were off in the first place. Mm-hmm. And so, diet, exercise, meditation, these things in and of themselves, you might find a study that says, there's a 62% reduction in exercise if you will work out 3 times a week for 45 minutes at a max heart rate of 80. Okay, that's a huge reduction, much more than pharmaceuticals can. And then you need to read another study about the reduction in symptoms that you can get from meditation, and the reduction in symptoms when you get your diet in order, and all the improvement in sleep. All of these different areas, you tack enough of those together, and you get a really significant proportion of the symptoms taken care of. Mm-hmm. So the idea is you can start on a pharmaceutical medication, get all these things taken care of, and then get off pharmaceutical